I'm Dr. Jennifer Gaudiani. My patients and their families call me Dr. G. I founded the Gaudiani Clinic because patients with eating disorders and disordered eating need a great internal medicine outpatient clinic. Therapists and dietitians deserve to have a doctor whom they can share care with so that they don't have to act as the de facto internal medicine doctor. And patients with eating disorders have a lot of medical problems. Some of them are measurable and some of them aren't measurable. They need a doctor with expertise in eating disorders who can bring the best medical care and also so much heart for the entire individual, for that interplay of body and soul in order to give them a better quality of life. The Gaudiani Clinic serves adolescents and adults with disordered eating and eating disorders of all genders from all over the United States. This can be a primary care clinic where patients can come and receive their medical care, their subspecialty care around medical problems related to their eating disorder, as well as routine primary care like flu shots and pap smears. Or where patients already have a great primary care doctor, this can be their subspecialty clinic, a place where I quarterback the care with their outpatient multidisciplinary team while providing great medical care for the complications related to their eating disorder. The Gaudiani Clinic takes care of a broad array of medical problems. Some of these are associated with classic eating disorder pathology. For patients who restrict, they may deal with a slowed metabolism, slowed heart rate, low blood pressure, constipation, gastroparesis or slowed stomach emptying, as well as bone density loss. Bone density loss is a big one because patients who lose bone density often aren't receiving the top evidence-based diagnosis and treatment to prevent fracture, height loss, and spine curvature. In addition, patients who restrict calories at any body weight and size can find that they have hormonal irregularities such as menstrual disruption, and these are problems that patients need to get evidence-based care for. For patients who purge, we take care of hypokalemia or low potassium, as well as dehydration. I think the top medical problem facing those with binge eating disorder is the medical stigma in the community that prevents them from receiving superb medical care generally. In addition to these more classic complications, the clinic also takes care of a broad variety of medical problems that are associated with eating disorders but not directly caused by them. These can include irritable bowel syndrome, abdominal distension, constipation or diarrhea that's hard to treat, the postural orthostatic tachycardia syndrome, or POTS, which can cause fluctuations in heart rate and fainting and can be very intrusive in a patient's life. These are among the many complications the clinic treats, which may not always be measurable by a blood test or by an X-ray. And in fact, what I can tell my patients, being an expert internist who specializes in eating disorders, is that even when I can't measure what they have going on, I can validate that it's real because I have the experience in seeing these conditions. And we can talk about ways in which we can incrementally help their quality of life by their bringing to me what works for their body and me bringing to them my medical expertise and slowly individualizing a plan of care aimed at improving how they occupy their lives. The Gaudiani Clinic is dedicated to taking care of patients in their outpatient lives. However, sometimes patients have to step up to a higher level of treatment. The clinic is here to help patients across the entire spectrum of what's needed when that happens. First, to discuss what's happening medically and how that might reinforce the need to step up to a level of treatment. Second, to have the discussions about where somebody should go, because there's a lot of different treatment programs around the country. Third, helping patients get into that program by writing letters, by sending clinicals, and by being the communicator that brings the whole team together. When patients step out of a residential or higher level of care, they also need an expert clinic to help reinforce the work they've done. Patients have worked so hard to get into a more recovered place, and at that point, the Gaudiani Clinic can help work with their dietitian and their therapist to keep medical progress in place, to keep reinforcing the messages of recovery that someone has worked so hard to attain. The Gaudiani Clinic is located in Denver, Colorado, right next to Rose Hospital. When patients come here, either for their first visit or during a subsequent visit, they'll find that if they need outpatient subspecialty referrals, they're easy to make. We make it really patient-friendly. At Rose Hospital, patients can get quick access to procedures such as an upper endoscopy, colonoscopy, gastric emptying study, and others. The clinic will help arrange this, and then we'll swiftly get results back so that those are communicated to the patient in a timely manner. The Gaudiani Clinic offers telemedicine services to our patients. What that means is that every patient comes to the clinic in Denver to establish care the first time, and they're always welcomed here thereafter. But when they go back to their state of origin, I'm able to do telemedicine on a HIPAA-compliant platform that allows us to have sessions that feel almost as intimate as if patients were actually in the clinic. When patients need blood work done or radiology services or other outpatient medical services, the clinic will coordinate that in the patient's state of origin. And ultimately, a long note is always written, and thorough communication among the multidisciplinary team is a priority. For patients who live outside of Colorado, our staff is committed to making sure that they have easy access to appropriate subspecialty care as well. We have contacts all around the country, and we're able to help arrange care, order labs, order radiology tests, and make sure patients get those appointments and get the results back in a timely manner. Adolescents and adults with disordered eating or eating disorders of all genders and all shapes and sizes deserve to have an outpatient internal medicine clinic where they can receive great medical care, where they can be taken care of mind, body, and soul, where they don't have stigma, but they do receive creative, kind, individualized care. We look forward to welcoming you to the clinic.